Hello, my name is Sam Bragg. I'm one of the physiotherapists within Older People's Services at Leeds Teaching Hospitals NHS Trust. Thank you for accessing this training resource on the management of cervical spine collars. I'm joined by Sasha Struthers, another of the physiotherapists from our team, and Giles Leeming from Ossur, who has kindly agreed to assist us in producing this resource.
The learning outcomes for this training are as follows: to explain the indication of a cervical spine collar, to demonstrate clearly the recommended handling techniques to safely fit, adjust and remove a cervical spine collar, provide advice on day-to-day collar care including pad changes, skin checks and washes, advise on appropriate documentation with regards to collar care.
Please be aware that there are other types of cervical collars in use across our trust, which may have slightly different appearances. The principles and guidance within this video are the basic handling techniques which still apply and are transferable.
There are many different diagnoses where a patient may need to wear a cervical collar. The reason for doing so is to prevent excessive neck movement, usually in order to protect the neck from potential injury or to provide optimal chance for healing. If a collar is not fitted correctly, it may allow the patient excessive range of movement which could cause serious harm to the patient. If a collar is not appropriately managed, there is potential for patients to suffer complications such as skin damage or irritation, not to mention patient discomfort. It is also possible that a poorly fitting collar can increase a patient's risk of falls.
A collar may require adjusting at any time of day, so it is important that the ward staff are comfortable in how to manage the collar, especially in out-of-hours situations. In order to receive an appropriate cervical spine collar for one of your patients, please refer to your orthotics department. Okay, I'm now going to demonstrate how to apply the collar to a patient. This can be completed with the patient in supine lying or in sitting. However, this process always requires two people to be present in order to support the patient's head appropriately. Here is a checklist. You may want to pause the video at this time to understand and absorb the checklist fully. It shows you what to look out for, correct points, or points that might potentially be wrong with a collar that's fitting incorrectly. To start, we want to make sure that the bed is at a comfortable working height for the person who is going to be supporting the patient's head. In this case, that's Sasha. So I'm going to raise the bed up to a comfortable height for Sasha to work out. Sasha's going to be supporting the patient's head for the duration of the procedure, and that's what makes it so important that the bed is at a comfortable height. So Sasha's going to place her hands.
So to support the head, I want to have my fourth and fifth fingers at the base of the skull and then spread my other fingers out evenly with a nice firm pressure.
Before we fit the collar, it's really important to make sure that the pads are appropriately fitted to the collar, making sure that there is no plastic overlapping anywhere on the collar, both on the back and on the front section. We need to make sure that the back of the collar is correctly orientated. Therefore, we need to make sure that the pointier end of the collar is pointing towards the patient's feet and the flatter end is at the top. There are also arrows on this particular model that should be pointing upwards when we fit the collar. These arrows here. So we start by placing your hand on the top of the pads and then pushing it gently underneath the patient's neck. Again, trying to make sure that the top bit of plastic is at the base of the patient's skull. On an air mattress in the hospital, this process is a little bit easier because you can push into the air mattress, giving yourself a bit more room. I'm now going to ask Sasha to hold the back of the collar in place with her hands while still supporting the patient's head. With the front section, we should now pull it and flatten the section out as much as we can, scooping under the chest and under the chin. Begin by loosely attaching the straps. We will tighten these shortly. Then apply pressure with your left hand or right hand depending on which side of the bed you are, keeping good pressure on the front, allowing you to correctly tighten the straps. Once satisfied with the tightness of the straps, we need to make sure that the chin is resting on the white piece of plastic, obviously with a pad in between. The plastic should not protrude forward of the chin. Have a final look around to make sure that there is no plastic touching the patient's skin and that pads are covering every section. Another common problem is that the pad has become folded over under the patient, so have a feel around with your hands underneath to make sure that the pads have not become folded.
So we're now going to demonstrate how to change the collar pads and remove the collar in sitting. So again, 2 people. Sam's going to immobilise the head. Once we're happy with that, just remove the front section. Take that away. And then the back section. We're just going to show you how to change the collar pads now. So a section at a time. It's all single patient use. The blue side is the patient side and there'll be washing instructions to follow. So we'll start with the back section. Just want to check that all the bits of plastic are covered. Now the front. Then to replace the collar, back section, as previously, make sure it's orientated the right way. So I'm just going to hold that there for me. And then scoot the collar in. And just adjust.
Changing the pads or adjusting a collar provides an ideal opportunity for nursing staff to complete a skin check of the area, which is normally covered by the collar, and this should be documented appropriately. In addition to skin check documentation, it should be documented when the collar pads have been changed to evidence the process. Also, should a patient remove the collar themselves, documenting this in the patient's notes is very important as it could guide further treatment planning. It is also possible to wash, clean and dry the patient's neck whilst changing the pads, prior to refitting the collar. Obviously, ensure one person remains supporting the neck whilst this process is completed. Ensure the patient's neck is dry prior to refitting the collar. If the patient wishes to have a shower, it is possible to shower whilst wearing the collar, before then immediately changing the pads afterwards to the dry spare pads. There are different sizes and types of collar to fit different neck and body types. If you believe a collar is not an appropriate size for a patient, please refer to your orthotics department for an assessment, or raise your concerns with a colleague who may have had more advanced training. Thank you for taking the time to watch this training video. Hopefully you now feel comfortable to manage a patient's collar on the ward. If you have any further questions regarding cervical spine collars, the orthotics department should be the first point of contact. Alternatively, some physiotherapists may have had specific training and be able to offer assistance. Thank you.